that's another misunderstanding, is people confuse potency with efficacy. Nothing. This is one of the most irritating things to someone who's actually educated, is that just because something 10 milligrams of drug A is equivalent to 200 milligrams of drug B doesn't mean you're going to get more of an effect.
Warning! You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
Out the door. Like, it doesn't mean you're going to grow more muscle. It just means you don't have to use as much of the drug to get the same effect. But using 50 milligrams of drug A is not equivalent to 1,000 milligrams of drug B. That there's a certain saturation point to where the muscle doesn't grow any faster, no matter how much drugs you take. So once your muscle's growing at the maximum rate, it doesn't matter how many more drugs you take. So 10 Halo might be equivalent to 200 Test, might be equivalent to 50 Tren, but it doesn't matter, because if you're maxed out on muscle growth, adding more Halo, it's like, well, if 10 Halo is as strong as 200 Test, then 200 Halo must be as strong as 4,000 Test. And it's like, no. That 4,000 Test isn't any stronger than the 200 Test. Or like in this example, that it doesn't matter. You can't grow muscle any faster than like 1 pound a month. In fact, it's much more like a quarter of a pound a month. So in 6 months, you'd be lucky to gain 2 or 3 pounds of muscle. That taking more drugs isn't going to make you grow more muscle. So using stronger drugs doesn't help you grow any more muscle either.
Greetings, Earthlings! Like, subscribe, and share this video. Share with a friend. Share with enemies. Share with people who think they know everything. I am a medical doctor, and I could be your doctor. Click the link in the description box. I can order you blood work. I can read the blood work. I can treat any illnesses. Basically, it's like an HRT clinic that's a one-man army. Also, I do coaching. Dr. Karina Dodson and I have a coaching business called Apex Coaching. So if you sign up with me, you get coaching, which is nutrition, programming, competition prep, or lifestyle coaching, as well as all the medical stuff. So you have 2 doctors in one business. It's going to be contest prep, the nutritionist, the programming person, and the doctor all in one. You can't beat it. It's integrated. It works the best that way. You'll love it. Make sure to do it. Click the link in the description box.
A Turkish lira, 30 Turkish lira is equivalent to $1, right? So it means you could go to a restaurant and get dinner for 300 lira. Or you could spend $10 US. But you're like, well, I've got so much more money. I could spend 300 US dollars and get 30 dinners. But you can't eat any faster, nor can your body hold more food. So it doesn't matter. Whether you use a $10 bill or $300 a lira, you could get 1 entree. Maybe you can eat 2 entrees. So you could use $20 of US dollars, or you could use $600 of Turkish lira. You can't eat more than 2 entrees. Anything else you buy just goes to waste. So it's not like it's going to taste 30 times better if you spend the same amount of money. Like, this tasted so good with 300 lira, and it tasted so good with 10 US dollars. If I was to spend $300, it'll taste 30 times better. No, it tastes the same. It tastes the fucking same. It doesn't matter how much money you spend on the entree. It doesn't change the entree. It's still going to taste the same. So it doesn't matter if you're maximizing muscle protein synthesis with 10 Halo or 50 Tren or 200 Test or 500 Masteron. It doesn't matter that Masteron's weak. With 500 Masteron, you have no side effects. With 50 Tren or 10 Halo, you have an enormous amount of side effects. So there's no reason to use the bad drugs when you could use the good drug. So that's what I mean is, you might say, well, I can tolerate 30 Halo without beating my wife, and I can handle 100 Tren without beating my wife. It's like, well, you could take 5,000 or 6,000 Masteron and not beat your wife. I mean, like, there's no limit to the amount of Masteron you can take and not punch people out. It doesn't make you angry. And it's like, well, I don't have a problem with rage. I have a problem with pimples. It's like, well, there's no limit to the amount of Masteron you can take and you won't get pimples. It's like, well, I don't have a problem with pimples. I have a problem with gyno. There's no limit to the amount of Masteron you can take and not get gyno. Red blood cells. I have high red blood cells. There's no limit to the amount of Masteron you can take and not get red blood cell problems. I mean, maybe there is at 3,000 or 4,000 milligrams a week, but 400 or 500 milligrams of Masteron a day is safer than more than like 5 or 10 milligrams of Tren. And it sure is. So people are like, Masteron's weak. I was like, well, when you can take 500 of it a day, no problem, versus 10 milligrams of Tren, and you've got insomnia and hallucinations after a few days of not sleeping, and you're violent, and you've got all types of other problems, brain damage. Like, it doesn't matter that in theory it's more potent, it's not more efficacious, but it does have more side effects. And I know you're saying, well, why are you talking about Tren? We're supposed to be about orals. Well, methyl Tren, and I'm getting to this, 1 milligram of dimethyl Tren is equivalent to 100 milligrams of injectable Tren acetate. So in theory, people are like, wow. So they think that means it's 100 times more anabolic. No, it doesn't grow 100 times more muscle. It means 1 milligram is the serving size, whereas with normal Tren, it's equivalent to 100 milligrams serving size of normal Tren, which in theory would be approximately as potent as 500 test, which would approximately be as potent as maybe 700 Masteron. So you'd be like, well, I could take 700 Masteron, 100 Masteron, or I could take 1 milligram of dimethyl Tren. The thing is that 700 Masteron, nothing's going to happen. 1 milligram of dimethyl Tren, you might have severe liver death. So it's not like you can take 700 dimethyl Tren and get 700 times the effect of 700 Masteron. It doesn't work like that. And I know that people don't get it, but no matter how many times I tell you it doesn't work like that, you're just not going to believe me, because that's what you want to believe. You want to believe that if you find the most dangerous, destructive drug and use as much as you can afford, you're going to have the biggest muscles of all. But that's not what's going to happen. You're just going to look like shit, and you're going to feel like shit, and you might die younger. That's it. That's all that's going to happen, is choosing the drugs that are popular on TikTok and social media, like Tren, is only going to hurt you more. It's not going to grow you any muscle any faster. And some people are like, well, yeah, it's stronger. It's more potent. You can get more out of less. That 1 milligram of Tren in sheep or rabbits or something was as effective as 7 milligrams of test, but had less side effects. Now that's test. That's not Masteron, that's test. So the way that these idiots think is like, that takes 7 milligrams of Tren. It's like, well, now it's going to do the same thing for muscle growth, but it's going to do 7 times the side effects. That's not the point. So you have to understand potency and efficacy are not the same thing. I'd like to thank our sponsor, Fusion Regenerative Therapies, where I am the Director of Human Performance. This is the practice in which I practice medicine. We'll be able to order you blood work and read your blood work and help you with therapy as needed based upon the results of your blood work. Please click the link to get a consult with me, and I can help you optimize your performance. Thank you.